to Philippa Whitford.
Very much, Madam Deputy Speaker. I have to say, obviously, I welcome what the Minister is saying, and she talks about starting to take action. But we've had Conservative-led governments for the last decade, so I find it a bit surprising to only be talking about starting to take action now. Because health is much wider than the NHS. This is a confusion that many people make. Health is about everything else. And the thing is, when Michael Marmot did his acclaimed review, Fair Society, Healthy Lives, he defined those social determinants of health, the conditions in which people are born, grow, live, work and age, and described that the variation is driven by inequity in power, money and resource. It laid out how public expenditure could act on the social determinants to reduce health inequalities. The problem is, while it was welcomed by the coalition government and there was even a public health white paper, no action was really taken. In contrast, in 2016, what we saw was essentially the repeal of the Child Poverty Act, certainly including the reduction targets to actually get more children out of poverty. So in the 2020 Marmot review, what we see is not success over the last 10 years. What we see is things going in the wrong direction. I will.
I agree with her about the social determinants of health. Would she agree with me that if we go back 10, 15 years before 2010, it was the Labour government that absolutely appreciated the social determinants of health and directed public policy to that end?
I would respect the work that Labour did, and child poverty was falling. And one of the interesting things is the upturn in child poverty that we've seen didn't happen with the crash in 2008. It happened after the 2012 welfare changes, and that is quite striking. And what we see, the impact of government policy has been austerity in every way and in every approach to individuals, families and communities. We've seen slow income growth for the vast majority of people over the last decade. There has been absolute inequality. The majority of growth that there has been at the top. The national living wage simply isn't a living wage. More people are in insecure work, 0 hours, the gig economy, and don't have protections. And as the Shadow Health Secretary mentioned, in all the discussion about COVID-19, we have been trying to highlight that people in low pay and insecure contracts do not get sick pay, and yet we will be asking them to stay at home for 2 weeks and self-isolate. In the meantime, the wealthiest people have actually trebled their wealth. So categorically, we've not all been in it together over the last 10 years. In addition to that, we've seen a restriction in public expenditure. We saw the regressive welfare cuts of 2012 and 2016 that have reduced support for families by 40%. The benefit cap, the benefit freeze, the 2-child limit, the 5-week wait for universal credit that puts people in rent arrears and in debt, PIP, the bedroom tax. Now, 80% or more of these cuts have affected women directly because they tend to be lower paid, they tend to be carers, and they tend to rely more on services. And of course, in the main, they are responsible for children. The disabled have also been particularly hard hit, and what we did not see is a cumulative impact assessment of female lone parents who are disabled who have 3 or more children, and some of them have absolutely had their income slashed. There have been cuts to local government and services. Interestingly, the least deprived areas face 16% of cuts, while the most deprived, on average, had 31% cut from their local government budget. And I have heard members of the Labour Party talking about between 40% and 60% cuts in their local government budgets. There are changes in the pipeline that were planned to move $300 million from local authorities in the north to the south. I wonder if that will be reversed now, because the Conservative Party has won some seats in the north. I will.
Madam Deputy Speaker, I want to put something on the record, which is that I had a harrowing case some years ago of a young female constituent, when I was a councillor, who was clobbered by the bedroom tax. She has MS and she's going to lose a lot of cash. I want to put on record my thanks to the Scottish Government for the action it took to ameliorate, to offset that tax.
I thank the honourable member for that recognition that the Scottish Government is spending over £100 million every year in mitigating some of these cuts, in that they do pay the bedroom tax, that they have set up a Scottish welfare crisis fund. But that's money that should be going into devolved areas, not patching up austerity decisions here. That isn't the role of the Scottish Parliament, to just be mitigating. Public health in England has been cut by £850 million. Again, the greatest cuts to the poorest areas. And that's exactly the same with future planned cuts. This has led to cuts in smoking cessation projects. There's no point in standing up and talking about the importance of stopping smoking. We all know that. But people who have smoked for decades need help to stop, and those services are critical. But we've also seen it to drugs and alcohol projects, to sexual health projects, and all of these have an impact on the poorest people. Now, the Minister who is no longer in her place may have listened to Dame Carol at the Drug Summit in Glasgow, but sadly, the Home Office Minister didn't. He came to Glasgow, made his speech, and then left before all the expert evidence was given. We also hear across England of a social care gap of over £6 billion. Again, that affects women if they have to give up work to look after elderly relatives or disabled children. This rolling back the state has affected the social determinants and increased health inequalities. Child poverty is increased, as we heard, 4 million children. 1,000 Sure Start centres were closed. Education funding is down. There is a housing crisis and therefore a rise in homelessness. People with insufficient funds to afford a healthy life are depending on food banks. And deprived communities simply are losing hope. Poverty is simply the biggest driver of ill health and has the biggest individual impact on life expectancy. So the increase in life expectancy in England has stalled for the first time in 120 years, since 1900. The gap between the most and least deprived has widened. It's now almost 10 years of a gap for women. And for some women in areas of the northeast of England, their actual life expectancy has dropped by almost a year. I will give way.
I always listen with great respect to what she has to say, but given that the SNP has its hands on many of the levers of the things that she has discussed this afternoon, I'm assuming from what she has said that Scotland is in a wonderful place of having narrowed health inequalities. And I'm wondering if she could perhaps compare and contrast what's happened in Scotland with what has happened in the rest of the United Kingdom, since I rather think the two are very similar.
Well, I think he might find if he waits to the rest of my speech, I will highlight some of the differences in child poverty. So what we have seen is life expectancy for these women falling. But when we look at healthy life expectancy, the gaps are even bigger. Time spent in poor health is increasing. And this, of course, puts pressure on the NHS and care services. We're always in this chamber discussing the pressure the NHS is under. But emergency admissions are double in areas with low life expectancy than in wealthier areas. And now women in deprived areas will actually spend 2 decades or more of their life in poor health. So improving the healthy life expectancy by at least 5 years was actually a policy in the industrial strategy, so that people could be active and engage in the economy. But yet what we have seen is an adverse effect, both on health and health equality. And we know that the health for most of your life starts in your early years. It actually even starts when your mother is pregnant. But child poverty is central to this, and it is rising. Defined as children in households with less than 60% of median income, England had child poverty down to 27%. It's now 31%. Scotland had it down to 21%, and it's now 24%. And that's because welfare changes are right across the UK. Poverty is decided in this chamber, It's not decided anywhere else. And the Scottish Parliament, as you heard, spends a lot of energy in trying to mitigate it. As we know, housing cost is a major contributor because of the shortage of housing. It's a rising issue among the poorest, where 38% of the poorest will spend 30% or more of their income on rent or housing. That was 28% 10 years ago. The Scottish Government have built 87,000 affordable houses, and that is part of why our child poverty level is lower, is the housing impact. In 2015, in the general election, the Conservatives promised 200,000 starter homes. They built precisely 0. With 4 million children growing up in poverty, it will affect their whole lives. And whenever it is raised, we hear at the dispatch box, unemployment is down, work your way out of poverty, this is how we change things. 2/3 of these children already have a working parent. And the problem is, all of this drives ill health. This will have to be...
I thank the honourable lady for giving way. Would she agree with me that children living in poverty are more likely to have to suffer mental health issues, and then they face the double whammy, as the Children's Commissioner recently found, of the postcode lottery of spending on children and young people's mental health, which really varies between about £15 and £200, depending on the area?
I totally accept that, and actually children in low-income families have 3 times the rate of mental health problems. 3-year-olds in a household with an income less than £10,000 have 2.5 times the chronic diseases. And by the time they even start school, what you find is the poorest children have over a year's gap in vocabulary. It is important to try and balance that. And that's one of the reasons why the Scottish Government is investing in early learning for all children, all 3- and 4-year-olds and vulnerable 2-year-olds, and also is put in a pupil equity premium that allows the school to have additional funding to try and challenge where they are serving poorer communities. The problem starts literally before the child is born. A woman carrying a female child is actually carrying her grandchildren, because the eggs in a female are formed in the womb. That means if that mother is badly nourished, then she will actually be affecting health for the next 2 generations. And that's something that needs to be changed. And that's why we have invested. We have a Best Start grant, which goes to the pregnant woman, goes at birth, goes at starting nursery, at school. There is food support, because you need to change that right at the start of life. Health and well-being should be an overarching priority for any government and for all their citizens, regardless of where they live. This requires a health in all policies approach, not talking about that clean air is DEFRA's issue. We need to have this as a cross-government policy where every decision is checked whether it will improve the physical, mental and environmental well-being of the citizens the government are responsible for.
Here.